Coming up today, how to spot plaque before a heart attack. We explore the quick test, giving you an inside look at your heart health. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Do you ever wonder just how healthy your heart is? Or maybe you want to know how much plaque is growing inside your arteries. Well, unfortunately, too many people don't think about coronary artery disease until something goes wrong. But today, it's a quick, easy test that can look inside your arteries. The CardioScore can give you peace of mind, or maybe motivation to change your habits, or even an early warning that a heart attack is brewing. Today, we are speaking with Mary De Leon, who got one of those CardioScores after her doctor noticed something was a bit off in her x-ray, and it's a good thing she got it. We're going to learn why. Hi, how are you?
I'm good, thank you.
Good to have you. Thank you for being here to share your experience. Also joining us is Kay Ness, an exercise specialist and CardioScore consultant here at the University of Kansas Health System. We also have Dr. Mazar Afak, a cardiologist and the health system's director of preventative cardiology. And just to be clear, you are not Mary's doctor.
That's correct.
But you're going to help us kind of understand why these tests are so important. And of course, you deal with patients with very similar stories as Mary. But before we get to the test itself, just take us back to this trip that you took to the emergency department. What were you feeling that led you there?
Well, on the 22nd, I drove myself to a hospital, to an emergency room, because 2 days before I was having upper back pain, and I'm like, no, what's going on? This is not normal. Then the night before I went to the emergency room, I couldn't even walk. You know, I had to hold on to the wall to go to the restroom. I go, this is not normal. If I'm the same, if I continue the same, I'm driving myself to the emergency room. So I continued the same, and I went. And they gave me a chest x-ray, and then the doctor came back and said, you have pleurisy. It's the infection, it's inflammation around the lungs. And they suggested that I do a follow-up with my doctor, which is Stephanie Treese, and she's also with you all here at KU. And the first thing she asked me when she seen me, so what'd they say about the plaque? And I said, well, what plaque? They didn't say anything about plaque. They said that I had inflammation around my lungs. That's all they said. No, you've got plaque. And I go, well, what am I going to do now? Well, I've got something for you. She goes, I want you to take a test. It's a CardioScore test. It's going to be done at KU. Someone's going to call you with an appointment time. And they did, and I went in, and that's where I met Kay.
And I just want to step back just a bit, because you also having some back pain as well, because I want to make sure people understand what kind of symptoms that you were having that led you to needing that, or even tipping you off to go to the emergency room.
It was severe back pain, you know, but I thought maybe I had pneumonia or something, but I didn't have no cough, no cold. I go, well, it was real strange, you know. But you know, the thing of it is that many times I felt that pain a little bit, but not as severe as then. So that's why I went to the emergency room, because I knew something was definitely wrong with me.
Very, very smart. So then after that, you go to your primary care doctor?
For my follow-up.
Okay, here at the health system?
Yes.
Okay, and so that's when they spotted something on the x-ray. I was just trying to get the sequence going. So that's when they spotted it. You were thinking this might have a lung issue, but then you were surprised when you heard the P word, plaque.
Yes. God, that just took me back to my mom. It took me back to family members. It just took me back. You know, it can't be. You know, I'm only 65. You know, but no, yeah, it was. I even cried. You know, I didn't want to go through that. You know, plaque. You know.
Yeah, it's a scary word. You never you don't think about it like that.
Your heart.
Your heart. Yeah, you don't mess around with that. Kay, so what's the typical path to getting this CardioScore? Is what you're hearing from Mary typical as far as someone finding themselves into an emergency room, and then people start doing some testing, and then here we are?
Yeah, that's definitely one route. We do get the majority of our referrals from primary care physicians, cardiologists. Patients can also refer themselves. Typically, it is because they are over the age of 40 with risk factors. So high cholesterol, we see a lot of patients with high cholesterol coming in and just trying to get more information to help stratify risk. High blood pressure, obesity, diabetes, a family history of heart disease.
That's what I was going to say. If somebody wants to refer themselves, who would do that? Who would it be for? For somebody just to say, hey, you know, my mom had that, or my grandma had that. I'm starting to notice a family history.
Right. All of those, if they have any of those risk factors, they're a really good candidate to have the screening.
So what is it exactly testing for? We say plaque, but kind of take us inside. What's going on in there?
So we are specifically looking and quantifying the amount of calcified plaque in someone's coronary arteries.
Doc, I want to bring you in here. So when you see a patient, how do you decide if they might benefit from a CardioScore? How do you know to send them in to get one?
So it's usually for patients who you, as Kay had pointed out, some of those risk factors are falling in that middle risk category of likelihood of having heart disease. So it's not a good test for somebody who's young and has low risk. It's also not a good test for somebody who has active chest pain and is very high risk. So somebody who maybe between 40 and 70 who has some of those risk factors is a good person to consider. And often patients will come and say, look, you know, my dad had his first heart attack at age 55, you know, and I'm turning 55 this year. I want to know more.
Okay.
So it could be that type of. So it's sometimes patient driven, but definitely sometimes when we're looking at, you know, trying to screen, that's where it comes in.
Sure. It's hard to not imagine somebody who's like a healthy person who takes care of themselves going, hey doc, I want to get one of those. I want to make sure I'm all clean in there and take a peek. But you're saying that's not how this works.
It can do if the patient's aware of it. And part of us speaking today as well is it's great to raise this awareness that this, you know, this test exists.
Well, and it's a conversation you can have with your doctor. You know, you may fall somewhere in between a risk factor, right? Okay, so is that something you could talk with your doctor about and say, hey, I kind of might be on the ledge there?
Yeah, and when you go see your primary care physician, behind the scenes, they are calculating your heart attack and stroke risk. But having that conversation and being able to identify those areas that you might have that haven't been told before, but they do help guide you in determining if you're a good candidate for that screening.
All right, let's do some show and tell because we're going to look at some video of someone going through the test. So what exactly should patients expect the day that they come in for it?
So I always say this is the easiest test you'll ever take. It's just a really fast, painless, you don't have to prep for it. You're going to go into that CT machine for about 5 minutes. And then the processing of the images only takes about another 5 minutes. And then if they come to the main campus, the Rainbow campus, they will get that consultation with me afterwards. And patients oftentimes say that that's the added value of having the test, because it's not every day you get to talk to someone right afterwards and find out your results. And so it can be a lot of anxiety to wait or to read your results in your My Chart and not understand them. So getting to go over that right away is really, really benefit.
Yes, in real time. Mary, you're shaking your head going, that was something you really liked.
I was so relaxed when I was very nervous, you know, just going to the appointment, what I was going to find out, you know. But she made me feel so comfortable, and she took the test, and she did the test on me, and then afterwards she gave me the results immediately. I wanted to cry there too when she told me. I was in the 800s, you know, very high, and that's why I recommended my husband also take the cardiogram score test, and he did as well.
What was your family history? You mentioned your mother.
My mother died at the age of 52 from coronary artery. She died on the operating table, 52.
So was this must have been always sitting in the back of your mind?
Yes, always. And her mother was also sick from the heart. But you know, my mom was a heavy smoker though too, you know. And the thing is, I've never smoked. You know, people think, well, since I don't smoke, my heart must be good. But no, you know, it can be what you're eating as well, you know, just not smoking, but what you're consuming. And I think that's where I went wrong, you know.
What was your lifestyle like maybe before and then perhaps now after?
Well, yeah, well, you know, we were brought up with real lard, you know, not Crisco, you know.
The good stuff.
The good stuff. Yeah, the sazon, that flavor.
Sorry, Doc.
You know?
I know you don't like to hear that. We don't like to talk about lard.
Yeah, and you know, you make those homemade tortillas with the lard.
Yeah.
You know, you refry beans with the lard. Now it's everything. It's either I use canola oil, you know, but I don't fry as much as I used to.
And it's making those small changes, Doc, right? That
Oh,
can really
definitely.
help.
Absolutely.
You like to hear that.
Absolutely. For sure. And again, it's small changes which are, you know, consistent at best. You know, not
Yes.
the dramatic, okay, I'm going to give everything up, but it's just that maintaining change.
Yeah, and I think just eating in moderation, just knowing that, you know, making right choices, you know. I love sugar, so my son goes, Mom, you'd choose a piece of cake over a good meal, which I would, you know.
Yes,
you
hello.
know. But, you know, the thing is that I'm so happy that I went and I took the test, you know, and I did. Dr. Cephas, he was excellent, you know, and I'm happy that it didn't go through the groin, it went through my wrist, and I was so worried about that, you know, but everything came out good. I'm really happy.
Well, okay, I want to stop for a minute because we're talking about this CardioScore, and this is a really cool part of the story this morning. The health system is proud to be the official healthcare provider of the Kansas City Current, and we are thrilled that they scored so many goals this season because every single goal came with a $1,000 donation, specifically going towards the CardioScore program. And we are joined now by Danny Welniak, the Vice President of Communications at Kansas City Current. Good morning. A big thanks to you, the Current, and CPKC for this donation. Good morning. Tell us about the goals that were scored this regular season.
Well, first of all, thank you so much for having me and for being able to really highlight this incredible opportunity. The goals scored this year were amazing. They were insane. They were record-setting, which is so cool to be able to talk about with you guys. 57 goals were scored in the regular season by the Kansas City Current. And what's even better than that is that CPKC actually agreed to continue through the playoffs. So the end result ended up being 60 goals that were part of that donation for CPKC Goals for Heart. And thanks to our partner, United Way, as well, they were able to help us really bring this to fruition. So a really, really cool and amazing thing to be a part of.
60 grand. It's such a fantastic way to end the season. And Danny, how did you all decide that this money should go specifically towards women's heart health?
Yeah, well, as you can see, I've got my little partner in crime here this morning. But heart health is really a passion for CPKC, and it's been a really long-standing focus. So it's actually one of the largest investments ever in women's sports for them. And CPKC has been involved in women's sports for years. And I really think that cardiac health, pediatric health, that's been a big focus for CPKC. And I know that United Way also really found this as an important thing and an important cause that they wanted to be a part of. So for us as the Kansas City Current to really help facilitate that with a record-breaking season is really, really cool.
Well, and looking back, Danny, at the season, how did you feel about the partnership between the Current and the health system?
Well, it's the University of Kansas Health System Training Center, which is a really important piece of everything that we do. It was the first training facility purpose-built for a women's professional team in North America, which is really cool to be able to say. But also, the University of Kansas Health System's focus on female athletes really made this the perfect marriage. And I really think the importance of player preparation and the health system having doctors that are really ingrained with the day-to-day and what this team is doing and what the athletes are doing, whether it's health, whether it's recovery, whether it's wellness. It was just the absolutely perfect marriage between these two organizations. And I have been so lucky to be a part of this and also blessed to really see what the University of Kansas Health System has been able to do to really impact the Kansas City Current and impact our athletes.
Okay, this donation goes to help the program that you run. What does it mean to you, and what's going to be the overall impact on patients?
Well, it means a lot. It's going to open up awareness to women's heart health, and it's going to provide access to a lot of women to have this preventive screening. And so we're very excited that we have this partnership with the KC Current and CPKC.
Well, another congrats, Danny, on the season. What's next for the Current?
Well, the beautiful thing is that We get
That's
to get
okay.
ready for
She's okay,
2025.
by the way. Your daughter can join us. Bring her on in if she needs to.
I was going to say, she really, really wants to be a part of this. So she
She's
gets that from her
excited.
mom.
She's excited.
She's
I
very
like it.
excited. She gets to go to all of the Casey Current matches as well. So she's excited about everything that's going on there. 2025 is going to be incredible. It's so fun that it feels like we're just getting started. Like 20 of those goals came from Temwa Shawinga by herself. So we are very excited to see what this team can do and how it's going to grow now that it has a whole year under a new technical staff and also first year in a new stadium. So the opportunity to go into 2025 with a new stadium and have that year under our belt is going to be really, really cool.
Well, it's been a thrill to watch and be along for the ride, Danny. Thank you so much. Enjoy the off season.
Thank you so much.
All right, we'll see you soon. Thanks. Well, we have more questions for our guests, but if you're watching live, be sure to ask your questions using the chat on YouTube or Facebook. You can email the Medical News Network. The information is there on your screen. So, Mary, I want to talk a little bit more about the test for those watching. We're talking about this CardioScore test, and we saw some video earlier of it. But is it pretty straightforward? You said you were a little nervous going in. What was the experience like, just for those watching and listening?
Believe it or not, my doctor had to prescribe me a volume, a real low dosage, just because I'm claustrophobic. And even if, so I was nervous, but Kay made me feel very comfortable, but I was, it was fast. For some reason, I thought it was going to be like a long time, but it went fast. It didn't feel like 5 minutes.
So better than you expected. That's all we can ask for, right?
Definitely better. I wish all the MRIs were like that, but no, it was fast.
Good, good. Doc,
and I felt comfortable.
Do you have concern when you have to prescribe people to go get this CardioScore? Do you have to kind of walk and talk them through what it's going to be like, calm their nerves a bit?
Yeah, I do, but actually, it's such a quick test. Actually, it's probably one of the quickest.
It's pretty open.
Yes, and it's just a cylindrical. It's just a circle, not like a tube necessarily that you go in for an MRI, which can
But when you're claustrophobic,
yes.
you don't think like that.
It might
you
as well be.
overthink it. Oh my God!
But,
yeah.
But for that reason, I think certainly MRIs can be very difficult because that's a tube and you're quite condensed. But with this, this open disc that you go through within 5 minutes, it's usually good. But you're right. If you're claustrophobic, if you're just contained even for a short time, it's difficult.
Well, no, and I'm glad you brought that up.
Yeah.
Just
Doctors do need to let the patient know a little bit. And my Dr. Treese was really good. She did let me know.
Well, and that's why we're doing this. We want people to know what to expect and what questions to ask. So, and we have the results, the CT scans from your CardioScore. We've got the red arrows pointing at some of those spots. Okay, what are we looking at from left and then over to the right?
So what we're looking at here is how that plaque is identified on a CT scan in her coronary arteries. We have the left anterior descending coronary artery and then the right coronary artery plaque.
So this is what you saw in real time as she came out of the test.
Yeah, so we then quantify how much of that plaque we are finding in the coronary arteries, and then that becomes your calcium score. And then based on your calcium score, we can help direct next steps. And in Mary's case, we recommended that she have additional testing that specifically is going to check for blockages.
So could you kind of tell us about what the score means as far as, a scale and numbers?
Yeah, so if they have a score of over 400, we consider that significant. And if they're 100 to 400, that's going to be moderate. Anything below that will be mild. But it's not only the total score, it's also the patient's age and even their race can influence how their score is going to compare to other people their age, because the probability of having detectable plaque does increase as we age.
Mary's arteries were 95% blocked. What would that have told you? That sounds shocking to me. What was on the horizon?
Well, that would have came later. So because this test is not specifically checking for blockages, we recommended another additional test that does check for blockages. And so, yeah, you ended up having a procedure that actually goes in and invasively looks at how much blockage she has and then if she would benefit from having a stent.
So, doctor, she said that she was having these symptoms that sent her to the emergency department, and it was back pain, really bad back pain, and thought it was her lungs. But can back pain be a heart problem? Do we need to really make that connection here today?
We do, and specifically in women patients, they can have more atypical, not typical symptoms, and back pain, jaw pain, shoulder pain, lower chest discomfort, upper abdominal discomfort, fatigue, shortness of breath, nausea, vomiting. These are just some of the symptoms that somebody can feel, and often in women they can dismiss their symptoms because they're busy. You know, they're looking after everyone else, and you know, they can put it down to stress or something different. You know, so it's often really, when we look back at, you know, when chest pain was first described by an American cardiologist in the early 1900s. Samuel Levine described it as a clenched fist against the chest when people were having active, you know, anginal chest pain. And even though chest pain is the most typical presentation, it's these non-typical symptoms that you have to be aware of.
So any and all of those,
Correct.
Get in and get checked.
Correct. And especially with your family history, with your risk factors, you did the right thing. And just to follow up on what Kay was saying, so the blockage, it tells us that there is plaque, the calcium score, but it was the ongoing symptoms that led to then a stress test. And the stress test then led to a cardiac catheterization. So that's the sequence of events, because you can have plaque. Let's say you have a mild plaque score, and you then just focus on diet and lifestyle changes and cholesterol control and those kind of things. You don't necessarily have to have a stress test. If you're not having symptoms, if you've got mild plaque, you just focus on changes. But it's the symptom portion which is critical.
Right, and it does. You can see the sequence of events that build to get you to where you need to go. Because Mary, you referred to a cardiologist here. So then, what did they tell you to do?
Well, my cardiologist was Dr. Hannon, Marina Hannon, and she's the one that referred me to have that stress test. And then the results from there led me to have that catheterization test. And that's where Dr. Surface put in the stent.
All right, so.
And that's where I found out that 95% of my right coronary artery was blocked. And that just blew me away. I'm like, what? You know, that's scary.
That was scary for you, especially with what you've known with your family.
And you know, now hearing the doctor, many times I've had symptoms like that, very fatigued, short of breath, like to where I was even tired to talk, you know. And I'm like, what's going on?
What did you think it could be? I mean, did you ignore the heart
aspect? I just ignored it because I'm always so busy. I mean, I have 15 grandkids, 13 great-grandkids, you know. And I help my son at his car dealership, and every once in a while, and I'm like, I'm busy. And then I was a pastor's wife for so many years, and we just retired from being pastors. So I was always busy, never time for everybody else but me. And we as women need to make time for ourselves if we want to live long, you know, and enjoy our spouses and enjoy our grandchildren, enjoy life. You know, we take it for granted.
Well, and that's it must be a familiar story you hear as you mentioned it. She said that's exactly what it was like for her. I want to show an image from Mary's stent procedure. I want to see what we're seeing here. It's kind of hard to see, but the arrow is kind of pointing it out. But can you tell us what we're looking at?
Sure. So this is an image, a still image from a cardiac catheterization or angiogram, and we can see a faint outline of the mesh-like structure, which is the stent, just where the arrow is pointing. There's two dots which actually signify the beginning and end of a balloon, which is inflated to open up the stent even further. So the stent has already been deployed there, and then the balloon is inflated further to really oppose the walls of the stent against the blood vessel wall.
And I think we have a before and after, right?
Perfect.
And that's what we want to see.
Correct. So this is lovely because it shows Dr. Surface's hard work of an outline of the initial right coronary artery. That's the dye going in. And where you see that arrow, you can see very minimal dye crossing that area. And then after the stent has been deployed, you can see the dye flowing through clearly without any restriction.
So is that what 95% blockage looks like on screen? Yeah. That's what we're looking at. What's it like to see that, Mary?
Wow.
Wow.
Yeah.
Did you feel any change? How did you feel immediately after? Was there a feeling as you started to recover and get back to life?
You know, I guess realistically, I still had fear, you know.
I was going to say, was it a state of mind more for you?
Yeah, I still had fear, you know, just now that I know I have to just eat better. I have to make right choices on what I'm going. It's really hard being a Hispanic, you know. We really get into a lot of deep frying and this and that. And my kids tell me, Mom, you know, you can't be eating that, or Mom, now I have babysitters, and always watching over me that I can't eat this and I can't eat that. But yeah, I want to live.
That's not easy to do.
No,
you
it's
mentioned
not.
It is not easy.
Well, because I'm 65. I'll be 66 pretty soon, and I've eaten like I've been eating for years.
You're the queen. You don't need all these people telling you what to eat, not to eat. But now I guess you do. So.
And I tell them, well, don't buy the potato chips. Don't bring them. Don't do this. Now, is it really wrong to eat potato chips?
In short answer, yes.
Oh.
That's the easiest question he's had all day.
How about sweets?
Sweets, like, you know, refined sugars, just bad.
No.
You know, so that saying you may have heard, eat food, not a lot, mainly vegetables. That's the key kind of thing. Is that
Maybe like a kiddo.
so if you say
that's the bad news you have for us. We have to eat lots of vegetables.
Avocados are good.
Avocados are good. Yep.
Okay, with tortillas.
And the nice thing is,
Okay, no lard tortillas. Has there been anything you've incorporated into your diet that you kind of are surprised by, that you never thought you'd be eating?
Vegetables. You know, we weren't brought up eating a lot of vegetables. Vegetables for us was lettuce and tomatoes and cucumbers, you know. But that's about it. But now there's so much more vegetables that I need to learn to eat, you know.
You were saying, I think I cut you off. What were you saying? Were you going to share more about? Because we're always looking for good diet tips.
right, no, I was just saying is that we've got fantastic dietitians, our nutrition service is fantastic. So there's so many resources within our health system as well to speak on, you know, how best we can establish good habits, good diets, which are also consistent with the foods that you like to eat. Because I remember when I was nagging my dad once about, Dad, don't eat this, don't eat that. He said, well, what's the point of living if I can't eat the things that I enjoy?
You hear that a lot.
So that's the thing that we have to really, the best sequence will be, is that when you go to someone's home and you've been invited for dinner, but you can still partake in the dinner without the host feeling like, hey, oh, they didn't try this, they didn't eat that, they didn't eat that. I think that's really the aim that I would have, is that you maintain your dietary restrictions, but without letting your host know that, hey, otherwise you might as well just go with a brown bag and just say,
yeah,
okay,
right.
Here's what I'm going to eat.
Right.
Okay, I want to get to some community questions because we've got a few good ones here. Vera wants to know, how frequently should someone have a CardioScore?
If they have a score of 0, meaning they had no identifiable plaque, then we would recommend about every 5 years that they repeat.
Marcia wants to know, since taking steps like changing the diet, exercising, and any medication intervention, will the risk then automatically go down? Does that change from person to person?
So when we look at what causes heart disease, we have genetics, we have lifestyle, and then we have your comorbidities, your numbers, your cholesterol, your blood pressure, your blood sugar, your weight. So we're trying to optimize all of those pieces to help reduce one's risk. And everyone's puzzle is going to look a little different. So any measures that we can take in any of those pieces are going to help reduce your risk.
Kathy wants to know, are those life screening companies that travel from town to town accurate and worth the money?
So I don't favor those.
You said that so politely.
But look, you know, if there's something that's putting forward your health, I think it's good.
Something that could tip you off to maybe go get a further, deeper look.
But if we look at really, like, you know, we should be guideline driven, and the U.S. Preventative Services Task Force does not recommend just screening for asymptomatic, no symptoms, carotid blockages. You know, that's one of the things that these traveling companies certainly do. They look at your what we call ankle brachial indices, looking for blockages in your blood vessels of your legs. They do a screening of your aortic size as well. But again, if we look at guidelines, asymptomatic screening, because it can open up, send you into a whole avenue of things which didn't need to be done. For aortic screening, a male 65 to 75 who's been a smoker, they should have a screening of the aortic size.
So it can tell you some things, but
Yes.
could it give you some false information?
Yes,
okay,
exactly.
that's no good.
And then cause unnecessary worry as well sometimes.
So just come see you. Okay, gotcha. Okay, so Jeremy wants to know, is plaque really the problem, or is it the red flag highlighting that there's a deeper problem?
So that's a good question, because by the time the plaque is there, that's a problem. So, but the plaque can be soft and hard plaque. So you could have a calcium score that shows no plaque, but you could still have soft plaque, which is not seen on the calcium score. So it's the visual and biological effect of what's been going on for years. So it's the manifestation of potentially years of problems.
Okay, the big question is, can plaque be reversed? Is it what I've always heard, it cannot be?
It cannot be reversed.
Cannot be reversed.
It cannot be reversed, and Kay and I have this discussion sometimes, and there is plaque can regress a little bit because what makes up plaque, cholesterol is a big component of that. So as our imaging techniques get better, you could actually have some reduction in that composition of what makes that plaque. But no, there is no reversing of removing of it like that.
So much great information today. What would you want people to really take away from this conversation?
I would say is that, look, first of all, we're super grateful for Casey Curran and for this grant, because it really will promote health awareness, and specifically in cardiac disease in women. Heart disease is the #1 killer in men and women, and I think is that if we look, we're coming into the holidays, and many people make commitments for the new year. Make that commitment to really focus on your health, to focus on prevention of heart disease. It's never too late to change. We've got so many good resources at University of Kansas Health System. Really good resources. So come in, get seen. We've got good resources, and just make a commitment to change. If not for yourself, I think for the loved ones that will miss you when you're gone.
Yeah.
That's really the key.
Really, really well said. Great message. Kay, what's the big takeaway today?
I would echo what Dr. Afak said about that it is the leading cause, and it's often undetected and preventable. And we are so fortunate to have this test available at the University of Kansas Health System. And today we actually do kick off the free CardioScores for women if they come to the Rainbow campus. And it does provide so much information to patients and providers, and is often life-saving to the patient. So it's so easy to not do. So go do it.
Go do it. Go do it. Mary, thank you just for being really open and honest about your experience and sharing with us. We're glad you're doing better and making some good choices.
Yes.
What is the big takeaway from those listening to your story?
Just to listen to your body, especially don't ignore what you feel, especially like the doctor was saying, all these symptoms and everything, which I ignored. And maybe it could have been taken care of and not gone so far at 95%. Could it? Or, I don't know. Could I have if I would have known like 5 years back or 10 years back, because this buildup wasn't just from one day to the next. How long do you think I've been going through this?
So plaque develops very early. When they've done post-mortems on World War II veterans, there was already plaque in healthy people who had gone to fight war.
Wow.
So there is development of plaque early. It starts even younger. So I think is that, I often think that when, I wish somebody had told me when I was in my teens, early 20s, look, be more healthy.
Or at least in my 30s,
Yeah, just really, it's never too early to start to be healthy. And, but fortunately, your blood vessels, you've had your stent, you've got good blood flow. Dr. Surface did a great job there, and like now all the hard work
Now
is on you.
Yeah.
Now I got the ball in my court, right?
Yeah.
So I've got to, right. And this is a wake-up call today for me too, because I really, not that I'm not taking it serious, but maybe it really hasn't hit me yet, And I think today I feel like it has hit me that, Mary, I really truly need to take change. I need to take hold of myself, of what I'm eating, and I'm not exercising like I was. Before I had surgery January, that everything went boom, 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 boom so fast. I mean, it was just like so fast. I mean, I went in the 22nd of November, I had surgery the 29th of January. I mean, I've seen all these different doctors, specialists.
So it really hasn't sunk in until now.
No, it hasn't. It hasn't, Yeah, I figured, God, how many more years do I have to live? I want to live to 120, but hey.
Well, this is a good start.
Health.
You're off to a good start. But somebody possibly in their 30s and 40s or 20s, as the doc said, let's start early with the habits. Somebody's watching and is going to learn from your story. So we just appreciate
I really
you.
do hope so that you just don't be like me and just let it go. Don't ignore it.
Thank you for sharing today.
You're welcome.
Thanks to all of our guests. Just a great conversation. Learned a lot. Thank you so much. And thanks to our viewers for being with us today and asking your great questions. We'll see you back here tomorrow. Coming up Wednesday on Open Mics with Dr. Stites. It's better for baby, it's better for mom. So then why are 75% of infants not getting breastfed like they should? I'm Jessica Lovell on the next Open Mics with Dr. Stites. We break down the barriers to best practices and show you the science behind the benefits of breastfeeding. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.